Evelyne Kahare. I'm a public health pharmacist, currently working in Africa, to be specific, the East Africa, from a country called Kenya, working in one of our cities, that is Nakuru City. I'm a public health supply chain pharmacist, supporting dispensaries and health centers at the lower level within the county that I work. I have a bachelor's degree in pharmacy from the University of Nairobi. I also have a master's in an MBA, strategic management, and I'm currently pursuing a master's in health supply chain from the East Africa Community Regional Center of Excellence, University of Rwanda, that is in Kigali. And I'm glad to be here to be able to share a few insights from the Global INDABA. Yeah. I was recently, that is in the month of March, really privileged to have been an IAPHL ambassador at the PtD GLOBAL INDABA at Bangkok, Thailand, whereby I was supported to attend the conference by Village Reach. They invited me to also be a panelist in one of their panel discussions that was talking about leadership and stewardship in supply chain workforce. This is a very dear area to me because, like what I've alluded to, I really work in the primary healthcare level. So the people that I interact with on a daily basis are my colleague healthcare workers who happen to be nurses, who are the healthcare workers who are in charge of the facility that I support, offering pharmaceutical strengthening services and supply chain strengthening services. So I really work hand in hand with the nurses at this level of care. So this panel discussion was very close to my heart, and I could be able to offer practical examples of how a leader should be able to instill change and a sense of ownership and belonging when it comes to managing health supply chain, especially being cognizant of the fact that nurses at this level handle so much work. For the facilities that I oversee, for example, case in point, the nurse is the one who is the clinician, is the administrator, is the prescriber, is also the supply chain personnel, is also the health data clerk. So these are all different skills that the nurse who is doing the same job, so is end up task shifting, so that you find that health supply chain can be failed to be given the necessary attention and laying of emphasis on what the impact of not properly functioning health supply chain, the effect that it can have on them in their health center and dispensary. So being able to articulate and relay the message of how I'm able to interact with this staff at this level, how I'm able to provide leadership, mentorship, support, supervision, and also just to be a good steward to help them feel and have a sense of belonging, even as they do health supply chain work, was really very humbling and privileging for me. So I shared the platform with very seasoned supply chain leaders. That is Francis from Management Sciences from Health. I also shared the platform with Pamela Steele of Pamela Steele Associates. And we had a very able moderator, that is Tapiwa from Village Reach. So we were able to really go and dive into details and discuss cross-cutting issues pertaining what affects good leaders, what defines a good leader, and how the characteristics of a leader and how you're able to instill leadership really influences the supply chain workforce. So from my perspective, what I was able to talk about are the challenges that I face as a young leader of the supply chain in the primary healthcare facilities, how I'm able to navigate, and we were also able to brainstorm probably on how we can see these challenges as areas of improvement or opportunities for even being able to create strength in our supply chain and not just as challenges. So the panel was quite vibrant. We had a very vibrant audience. And my take-home message is in your own capacity, that nurse who is at that health facility, there is something they have to offer. They probably have not gone to a formalized supply chain school, but as a leader or a good steward for health supply chain, you can instill in them the necessary skills and competency to professionalize health supply chain at their level. Another take-home message for me was how to navigate the complex political landscape that really affects how we're able to do our duties, because health products and technologies are a very emotive area from where I come from. So there's normally a lot of political interference and a lot of political interest. But as a leader, you should stand up and stand your ground for ethical practices and be sure to do things by the book and just to enhance the last mile delivery of these very vital health-saving commodities. So after the panel discussion, it was concluded that as a leader, we should be able to instill change to the people that we are serving and leading. And also we should have a good, conducive working environment that will encourage professionalization of the supply chain workforce, because at the end of the day, you cannot offer what you don't have. Yes. I think I would want to close with a very with a quote that really got to me. It says, "It is better to lead from behind and put others in front, especially when you celebrate victory, when nice things occur. You can take the front line when there is danger." That was a quote that was given by Nelson Mandela. I will repeat, it is better to lead from behind and put others in front, especially when you celebrate victory, when nice things occur. You can take the front line when there is danger, by Nelson Mandela. Being a leader is quite a humbling experience, and you can only instill the positive change and impact that you want to be seen if you're also able to lead by example. So those are my parting shots, and leadership and stewardship will go a long way in really professionalizing our health supply chain, especially at the primary healthcare facility.